Welcome, Dr. Hirsch. Today, I would like to ask you about a topic which is most talked about but least understood. In fact, it was the theme of the World Health Mental Day in 2016. And this term is very casually used by people that, oh, my teacher scolded me, I'm very depressed because I broke up. So let's ask a mental health professional that what actually depression is.
Thank you, Ms. Pua, for having me here. I'm very happy to talk to you about this topic. Um, so let's talk about depression, what it is. Um, you mentioned that people, whenever they are stressed, they feel that they have depression. I think it's a very common misconception about depression that, equating depression with sadness. Um, so I'll just start by, giving an example of what exactly is depression. Um, from our own personal experiences, I myself experienced sadness, and I'm sure you must have experienced sadness as well. Imagine the worst day that you ever had, the amount of sadness that you felt. Probably, for me, for personally, failing an exam, you know, that was something which was very sad, or losing a loved one. So imagine the sadness that you experienced that day. Let's have a thought exercise. I'm sure if one of our viewers can imagine it in their head, the worst day that they've ever had. So imagine the sadness that you had in that moment, and how do you feel about it? It's an intense sort of sadness, and along with that, you suddenly lose interest in the whole world. You're not Nothing can cheer you up. Um you know, you don't feel like talking to anyone.
And you feel that probably you might never come out of it.
Yes, and your energy is low. You don't, you go to bed and you're not able to fall asleep. You have thoughts, you have anxiety about what is happening with my life. You have thoughts of even hurting yourself, committing suicide, thoughts of harming yourself, or maybe even you try to cope with it with alcohol or any other drugs. So you lose confidence, your self-esteem is low, and we have all experienced that. For a day, we have all experienced intense sadness, right? But gradually, after a day or two, we gradually get out of it, right? We friends help us, they ask about you, so we gradually move out of it in a couple of days. Now imagine if you're not able to get out of it for at least 2 weeks, or even if you're not able to get out of this intense sadness for months together. So that's what I'm getting at.
Okay.
Intense sadness can be experienced by everything, but having this intense sadness that affects your body, your thinking, your whole being, and suffering from it for a continued period of time, for weeks together, for months together, that's what we call as depression. So to summarize what I've just said, depression is basically a constellation of these symptoms of feeling intense sadness, of having decreased energy, not able to do your work, not able to have relationships, having a low self-esteem, low confidence, thoughts of suicide, disturbance in your sleep, disturbance in your appetite. So it's affecting your body, your mind, and your social status. So that's what it is. Depression is.
Now, having talked about depression, I'm curious to know about the causes that lead to depression. Because people normally give very normal reasons for it. Oh, I failed in a relationship, or my car broke down. Even as lame as that, I'm depressed. So, what do you think? What are the causes that lead to depression?
I think, as you just mentioned, that any sort of sadness can be caused by anything. A car breaking down, just difficulty in relationships. But the cause of depression, as we know it, the clinical depression as we know it, is one of the major factors is genetic. That is, having a family history of this disorder, having it in your family increases your chances of having this depression. So that being the most important cause. Uh, but there are multitude of factors. See, what happens during depression is there are certain changes take place in the brain. Uh, we have, modern science has identified certain structures in the brain which are affected by depression, certain molecular changes which happen because of depression. So we know the chemical, the neurological, the structural, the functional basis of it in the brain. But why does it happen is, as I said, one being a family history of it. I mean, for example, if if you face a great stress in your life, if you lose a loved one, you might not go into depression, but somebody who's already has a history of it might take that that the stress of it might cause him to go into depression. So also there's again one being biological factor, there is a family history. The second reason being, imagine if you're having a stress which is unbearable and which has been present uh, since your early childhood. Early childhood experiences have been shown to increase your chances of depression.
Leave an imprint in your mind for
Yes, in fact, there are certain, it can lead to certain changes in your brain.
for life.
Yes, and that in fact increases your chances of having depression. So there, so this being the another most important cause, early childhood experiences, child abuse, having difficulty in your early parenting. So these again increase your vulnerability for depression.
Does you say that family genetically, you are affected by it, but does family environment matters too? If you have a grim environment at home, and everybody is depressed, everybody is talking about it, even if the person is very positive, but do you think that he can some point of time be depressed, and can lead to that path that leads to depression?
Um, I think again it's a matter of coping as well now.
Yeah.
It's the mental resources that the person has. For example, I mean, not everybody deals with stress in the same way. For
Yes.
some, it might not lead to depression, but a person who is predisposed for it, it can. A prolonged period of stress can lead to depression, because as a prolonged period of stress in your body, on your mind, can also produce changes in your brain. In fact, recent research has shown, the mechanism through which stress works in your brain is through stress hormones such as glucocorticoids, and these have been found to be in fact mediate the depression and mediate the changes of depression. So yes, a continued period of stress on you can lead to certain changes in your brain and increase your chances of having depression. So yeah, I suppose having, but of course these can be mitigated by other factors. For example, if there are protective factors, if you have somebody you talk to, if you have, if you go into some sort of a therapy where you can change your way of that you think and how you react to situations. So there are things that we can do to in fact stop this from developing into a depression.
Now you're saying that talking helps. One must share one's feeling. So does talking and sharing really helps? Or there are other techniques that you use for the treatment?
In terms of treatment, it's a fairly vast topic, and I'll try to summarize it systematically. Um, First of all, if you have what we call clinical depression, where you are showing all these signs which I just mentioned earlier, so in that case, if you are into what we call a severe category of depression, we would want to start you on certain medications. These medications actually change some of the receptors, some of the neurotransmitters in your brain, and bring about changes which are caused by which revert the changes of depression. So treatment with medication sometimes becomes very important for people, especially for people who are very genetically predisposed, because in that case, talking therapy is not the best form of treatment. There's no evidence for it. So if you're suffering from severe depression, we would probably want to start you on medications. uh, Even for some moderate types of depression, we would, if a person wants, then we can put him on medications which definitely help. So it affects the success rate of these medications is quite high. So, and there's evidence of their effectiveness, and the side effect profile is also not also warrants us to use these medications. uh, so coming back to your question, then once a person has started recovering from the very severe symptoms, when they are on their path to recovery, then we move on to side by side we start what we know as talking therapies. Now talking therapies can be focused on what sort of problems we want to focus on. For some people, for the most effective form of therapy is what we call as cognitive behavioral therapy. um,
And what's that?
uh, Cognitive behavioral therapy is a form of talking therapy where we actually try to target a patient's thoughts and feelings. So to give you an example, when a person has depression, depression can lead to thoughts of low self-confidence, decreased self-esteem, and based on the patient's previous life, he might have certain wrongful assumptions about himself. For example, he might think that he has failed an exam, so he's not meant to study, he's somehow inferior to his colleagues. So now that thought, because of the mood that he's in, because depression just keeps building up. So uh, on a regular day-to-day basis, we always doubt ourselves whether we are good enough, right? But when a person has depression, that thought just amplifies. So, and that amplification of thought then further worsens your mood even further, right? Because if you keep thinking these thoughts, then your mood further worsens. You're not going to venture out because you always feel that you're no good. People don't like you.
Self-doubt.
Yeah, so that increases. So we need to break that cycle, because it's a vicious cycle of bad thoughts leading to bad mood, and bad mood leading to symptoms of depression. Depression then further worsening these thoughts. So becomes a vicious cycle. So we need to break this cycle at the thought level. And how we do it is what we know as cognitive behavioral therapy. We try to identify these wrongful assumptions and thoughts, right? So we try to challenge the patient. Why do you think that it is so? Why do you think that you're somehow inferior? So, and these thoughts usually we have seen are wrong. In fact, they have no basis, they have no evidence for it. It's just something that started and just stuck with them. So if we challenge these thoughts, whenever, for example, we teach patients, we make them practice thoughts uh, of challenging these thoughts. For whenever a thought like a negative thought enters the mind, they have to challenge it. Why I'm thinking so? Is it really so? Is it just imagination? Is it just a symptom of my depression? And with continued therapy, and this takes time. That cognitive behavioral therapy is something which is done on a long-term basis. Takes about 14, 16 sessions. Might take about 3 or 6 months, but it
That's long.
works. Yeah, but it works on the core symptoms. It works. It goes a long way in maintaining remission, that is in keeping depression away. So it has not only just treatment value, but it also helps further in your life, that you can identify your symptoms of depression, change your way your thoughts are. So apart from CBT, there are other forms of therapies as well, which we tailor based on the patient's needs. um, but yeah, talking therapy is definitely one of the most important parts of treatment of depression.
Dr. Harsh, do you feel that people are reluctant to talk about this topic because most of the time they are not even aware of the changes in their behavior? And by the time they come to know, they either try to hide it or they refrain from taking a treatment. How do we address that?
um, I think it's a very um, sensitive topic. Anything that is personal is very sensitive. Um Identifying your own faults, identifying your own shortcomings, can be difficult for anyone.
Yes,
Uh,
right.
as people, we are always, told to be, you know, we're always told to be brave. We are always told to be idealistic. We are always told to be the best that one can be.
And we are told to express our emotions. I think that also lead to a lot of,
Well, not in all cultures, but I can see. I mean, some cultures expression of emotion is not that. I mean,
especially for men.
especially for men, yeah.
Yeah.
So it's a multitude of cultural and social factors why this stigma against treating yourself, treating your mental illness exists. uh, but I think the core issue is here is we have sort of separated the mind and the body
Yes.
as a culture. The WHO definition of mental health actually says that normal health is not just an absence of physical deformity or absence of a physical disease, but is also a state where a person can actually realize his true potential. And by that I mean he's able to live a life where he's has good relationships, he's working, he's contributing to society, and his mental health um, is also fine. So it's the concept of health itself needs to change for us as a society. We seem to think that you can visit a doctor if your physical health is wrong, but mental health is something that you have to do it by your own self or do it with the help of family. But so if you change that attitude of thinking of mental illness as something that needs treatment, only then the stigma can reduce.
Thank you, Dr. Harsh, for sharing your views on depression. Thank you.